Ever heard of aortic stenosis and wondered how it affects your heart? Well, it's essentially the narrowing of the valve between your left ventricle and the aorta. This usually occurs due to calcification or congenital malformations and even inflammation. With the valve narrowed, your blood flow gets obstructed, causing the left ventricle to hypertrophy and contract more forcefully. Imagine trying to squeeze a large volume of water through a tiny straw. Symptoms? Well, they range from shortness of breath during exertion, signs of left ventricular failure such as paroxysmal nocturnal dyspnea, orthopnea, pulmonary edema, to dizziness, fainting, and even chest pain. During a physical examination, a healthcare professional might detect a loud systolic murmur, an S4 sound, and palpable vibrations over the heart and along the carotid arteries. For diagnosis, doctors often rely on echocardiography, MRI, or CT scanning to assess severity. Severe cases may require surgical intervention, with decisions made based on individual patient factors and disease severity. Now, let's shift our focus to another heart condition, aortic regurgitation. This is where blood flows back into the left ventricle during diastole, causing it to expand and pump blood with increased force, leading to a surge in systolic blood pressure. The body compensates for these higher pressures by widening the arteries, which reduces resistance and lowers diastolic blood pressure. Aortic regurgitation can be caused by a myriad of factors, including congenital valve abnormalities, inflammatory lesions, aortic dilation, and even infections like rheumatic endocarditis or syphilis. The symptoms vary from a forceful heartbeat and arterial pulsations to fatigue and signs of left ventricular failure. A physical examination can reveal high-pitched blowing diastolic murmurs and widened pulse pressure. Diagnosis is confirmed through tests such as echocardiography, MRI, or cardiac catheterization. Prevention focuses on treating bacterial infections to prevent aortic regurgitation, and medical management involves a range of strategies from lifestyle changes to surgical interventions.